Good morning, Chris Long and South Peninsula Hospital. This is Chris Harkin with Cooper Surgical. I'm going to give you a brief video overview of the RUMI II, which is here, blue handle. And hopefully this will make a lot more sense if you can actually see it live. So a few things you need to have a 10 cc syringe available. You need to have a 60. Assortment of tips, which you have all of those. 3 different cups. 3 centimeter, 3.5 centimeter, and 4 centimeter wide. I do recommend having a cervical sizer, and I'll show you that in a minute. And then also having some KY on the Mayo stand. First thing you'll do is you want the doctor to dilate the cervix. Then they're going to sound. We always recommend sounding so you can pick the appropriate length of tip. Could be 6, 8, 10, 12 centimeters long. That's really important because there is a balloon on the tip that needs to anchor the device, and it's important that we get the balloon into the uterine cavity. If it's in the cervix, it'll pull out. So after they've sounded and picked their tip, you pull it out. It has 2 catheters. It has a white one, it has a clear one. Go ahead and take the clear one, just pull on it and take it off. That's for dye, and if you're not doing dye, there's no need to use it. Next thing you do is you take the little metal pin, put it on the tip of the RUMI. You're going to push hard and turn, and it should fall into place with the catheter being either on the right or the left. Here's where I strongly recommend, if you'll take some KY and just run it in the channel. There's 3 channels. There's one there, one here, and one here. That will allow the catheter, because you're going to run your finger and you want it to recess. So you just take your finger like that, and it just sinks very, very well. And that's important because when we choose to put our cup on, we don't want the catheter to get pinched. So I've put the catheter down into the channel with KY. Now the doctor can use the sizer if they have them. And basically what they would do is they would just take the cervix and come in. I'm going from the side, but they just want it to be not pinching, but just glides along the cervix. And then there are numbers on here, and it'll say 3, 3.5, 4. It tells them exactly what size to use. At that point, they pick their cup. It has an occluder on it. The occluder will handle 40 to 60 cc's of air, and that is blown up either just prior to colpotomy or at the beginning of the case. And the tip, which is on here, which we'll do in a minute, you're going to put 3 to 5 cc's of saline in the tip. You can go as much as 10, and I have a lot of surgeons that like to do that. So now to put the cup on, handle is always face up during the procedure and installation. There's an arrow, a black arrow on this, so I always point this up at my chin. I grab the cup. You notice I'm holding it by the occluder, and there's an arrow right here just below the occluder. And what you're going to do is you're just going to hold it so it's at a 90-degree angle, and you're just going to rotate it back and forth until I get the black arrow and the white arrow lined up. At that point, we're going to, as long as we have the catheter out of the way, you push up one time and then a second time hearing the last click. And now it's fully engaged. I did not pinch the catheter. So now the surgeon will take a tenaculum, they'll grab the cervix, they'll insert the tip, they'll blow it up, 3 to 5 cc's of saline, which is here, and that just goes on with a little locking. After they've insufflated, you just go ahead and press the locking mechanism. Next, there's a rib on the disposable component on both sides. You're going to take your thumb, the surgeon will, and they're going to just push and advance it forward until it lines up with this line, and we're going to hear a click. Now it's engaged. The cup is intact with the cervical stop, which is the white foam, and it's ready to go. Now they can, if they would like, they can go ahead and blow up the occluder now. Normally I'll see a surgeon start with 40 cc's, or you may choose to do it just prior to colpotomy. You just don't want to forget. And once you blow it up, you also have a locking mechanism. As far as manipulation, it's a very stout device. You can put a ton of cephalad pressure. If the surgeon needs to antiflex, there's a black button here at the distal tip here. They're going to push it in and rotate the handle to the left, and it will go 90 degrees antiflex. If they want you to retroflex, it will go 50 degrees when you go to the right. So pretty simple. And then I think one of the most challenging things I hear is, how do you take this off? It can be difficult, but what I recommend is just hold it like this, take your fingers and just pop it to the side, just like that. Don't take it off yet. Now that you've dropped it, the shoulder below, push it forward about there. And now if you take your fingers on the side and push down, it comes off very, very simple. So that is the RUMI II. I wanted to make sure you all had a visual learning tool, because it's a lot harder to do just hearing my voice over a phone call. So I'm always available. If you get stuck in a case, you can certainly call me. I'm pretty quick to call you back. But if you have any questions, either watch the video again or call me. But I would recommend everybody at least assemble it and disassemble it before the case. And I think you guys will really like it. I think your surgeons will like it. Unfortunately, I will not be up in Alaska until the end of October. But I can certainly come down and assist. I'll be showing up, I believe it's the 29th or 30th of October, and spending the week. So anyway, thanks so much. Good luck. And I know you guys are going to like it.